Hi everybody, Dr. Nayo again with Rupa Health University. So happy to be here with each of you all wherever this video is finding you. So today we're going to talk about what is really stressing you. So we're going to talk about that in the context of understanding adrenal health and how that can go awry, and then how can we support that and nudge the adrenals in our whole system back into wellness. So before we get started, as always, let's just start with an open mind and open heart, and just close your eyes and take 3 heart-centered breaths in and out of the center of your chest, and then bring something into your mind that makes you happy, makes you smile, your kids, a sunset, your spouse. All right, so hopefully now we're all in a state of coherence, which is great, which is going to make us more able to receive information and just have us in a more healing state as we go through this talk. So what is stress really doing to you, and how do we do something about it? Before we get too far down the line and understanding how do we do anything about it, I want us to all understand how our stress system is actually here to support optimal wellness. And so let's go through things one by one and first understand it from a 360 view, and then we'll kind of dive deeper as we go on. All right, so first, your adrenals and the rest of your endocrine system are really here not to create dysfunction, disease, disorder. They're actually here to support wellness. And when we're in a state of coherence, which is why we always start our talks that way, the body is more easily nudged into a state of wellness. This actually is really important when we're talking about the adrenals in particular, because the adrenals are your main endocrine or hormone glands that actually are helping you to respond to stress. And they work with the rest of your nervous system in order to push your body out of a more fight or flight, fright state into more of a rest and heal, restore, recharge, regenerative state. So this is really important, that we have to understand that every time that we choose a thought that puts us in fear, worry, doubt, shame, that moves us over into a fight or flight way of being. And that really starts to deplete our ability to manage stress. And that's important because when our adrenals aren't there to kind of keep balance and they're constantly having to deal with stress, that means it's not tending to a lot of the other things. So this will become more and more clear as we go on. So your adrenal glands are part of your endocrine system. Your endocrine system is what in lay terms we'll talk about as your hormone system. And it's very important to understand the adrenals are not working in isolation. They are a big part of a whole system meant to keep you well. However, the entire endocrine system, which we'll look at in a minute, should be working together to support balance and health. So here's just kind of a brief pictorial synopsis of what's going on here. One thing that's missing on this page that I'll touch on next in the next slide is your hypothalamus. Think of that as your kind of grandfather gland of all of the endocrine or hormone system. But the pituitary system is the next in line. So that would be the mother or father of our endocrine or hormone system. Then all of these here, the thyroid, the thymus, your adrenal glands, pancreas, testes, ovaries, and something that's not on here, the GI tract, all of those these are what we call the endocrine tissues. Okay, so this elegant system that we call our endocrine or hormone system is really important to understand how it works. And so starting at the level of the hypothalamus and then the pituitary, there are different hormone signals that are chemical messages that are sent to these downstream glands. And today we're talking about adrenals. And so with all of these chemical signals, that's going to tell the specific endocrine gland what to do and how to respond to whatever state is going on in the body. And these different chemical signals can be involved with the ovaries and testes to regulate hormone and sexual health. They can be involved with your pancreas in terms of insulin and blood sugar regulation. And today we're going to focus on what the adrenals specifically are doing to support wellness. And so this whole entire endocrine system is composed of your hypothalamus, that's the grandmother, grandfather, your pituitary, mother, father, the thyroid, your adrenals, your thymus, your ovaries or testes, pancreas, parathyroid glands, kidneys, stomach, intestines, and of course, as we're talking about today, the adrenals. So we're going to focus in a little bit more, getting more specific with the adrenals. So as I mentioned, this is the master regulator of hormone health. It's called your hypothalamus. The hypothalamus is receiving information throughout the body and from whatever gland or tissue it's regulating. So the adrenals are also sending back either positive or negative feedback information. And what that means is that if the hypothalamus is regulating stress, what we're talking about with the adrenals will be sending back signals to let the hypothalamus know whether it has enough hormone to be dealing with stress, or whether, and so that's called negative feedback. It'll be kind of telling the hypothalamus no more hormone, or it can be utilizing a positive feedback, letting the hypothalamus know to keep sending more hormone. So this is, and it's picking up, the hypothalamus is picking up information throughout your whole system. So you can think of it like as a something that's in a constant state of surveillance to keep balance in your body. So that's the first line of managing balance, and specifically with hormonal health. Next is your pituitary. So your pituitary receives signals from the hypothalamus and the pituitary, and can also receive feedback from these other downstream systems, i.e. your adrenals. And then the third part of this system today, it's going to be the adrenal tissue that we're talking about. So all three of these, although there is a hierarchy in terms of who's running what, there is still feedback that's available at all levels, and that's very important to understand. So what do my stress hormones do, and why do I really even care about them? So remember I said all hormones are chemical signals that are secreted by your endocrine glands, and today we're talking about your adrenals. These are going to regulate whatever the function of these specific glands are. And so we're going to get deeper into that and how the adrenals are regulating your stress response. All right, so what's an appropriate adrenal response? What's meant to happen is you have some sort of stressors, which you hear people classically talk about as a lion's chasing you. And this is a real physical imminent threat to your survival. So the stressor is perceived. Your hypothalamus then perceives the stress and sends a signal to the pituitary. The pituitary then signals your adrenals to make stress hormone to be able to mobilize energy and blood flow to your large muscles, your eyes, so you can see, your heart, etc. So it's going to signal, and specifically to right now we're focusing on the adrenals. So it's going to signal your adrenals to release lots of cortisol, as well as norepinephrine, epinephrine to respond to stress. What's meant to appropriately happen is that stressor then is supposed to clear. You run and you get away from the tiger, and then your body is supposed to go back to homeostasis, which is just a rest and restore state where you're calm and everything is back in balance. And so your body can acclimate and then do all the restorative functions like digestion, detoxification, etc. So that's an appropriate response. So I kind of went over this, but this is just a review for you. The hypothalamus is your master gland that's talking to all of your other hormone systems or endocrine aspects of your endocrine system. And one note that I do want to make here is the heart is also meant to be involved in directing this whole entire system. So the more that we're living in a state of coherence, living from our heart, the more we're going to easily more influence our body, starting at the level of the hypothalamus, to be in balance and not to stay over here in a stress state where things are just chaotic and long-term promotes on disease or disorder. Then the next level is the pituitary gland. So that's your father and mother gland that speaks to the individual organs, the adrenals, thyroid, pancreas, ovaries, testes, etc. And then the actual endocrine glands. So that would be the adrenals today is what we're talking about, but the thyroid, the ovaries, the testes, the pancreas, etc. So this whole entire system is always getting information from throughout your system to know how to respond. And when we're living from a state of coherence, so living from a heart-centered place, we actually are going to influence that very favorably to promote health. So now that we have that pretty clearly understood, we're going to dive specifically into the adrenals. So the adrenals are right here. They sit on top of your kidneys. They release cortisol, as I mentioned, norepinephrine and epinephrine, and those last two neurotransmitters, hormones, they're known as commonly as adrenaline or noradrenaline. And these are your major stress hormones that are helping you to deal with an acute or chronic stress response. So when we're thinking about what adrenal dysfunction is, you're going to hear functional medicine doctors talk about it probably as HPA axis or HPA dysfunction, which is hypothalamic pituitary adrenal axis dysfunction. And the reason we call it that is because there's dysfunction at all three levels. It's not just the adrenals that are receiving information that are throwing the system out of balance. This HPA axis dysfunction can occur with a chronic recurring stressor or a major acute stressor that really just kind of drives your body into a state of overdrive. And so that's basically when our system is just constantly slamming on the gas. And so we're go, 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 and flooding our system with stress hormone. This stress can be an emotional stress, can be a physical stress. So like I said, a tiger chasing you, or it could be like if you have a serious chronic health condition, that can be a chronic stressor that actually depletes your HPA axis. It also could be a mental stress. So like if you have something that you're worried about, there's a child or something that you worry about, all three levels, physical, emotional, and mental, can really have a can serve as significant stressors to your HPA axis. So what happens if we have unmitigated stress that's causing dysfunction? So stress is perceived in the mind, and I put hypothalamus and pituitary, but that's just to kind of let you know the part of the brain that's actually dealing with stress. But the mind is not necessarily what I'm speaking of, just the hypothalamus and the pituitary. It's what is the overall state of our thoughts? Are we in a worried state? Are we in a panic state? Are we in a well state? That is actually going to influence and tell the hypothalamus and the pituitary, are we in a state of balance or are we in a state of fight and flight? So then once the stress is communicated via the hypothalamus and the pituitary to the specific glands, the adrenals, that's going to ultimately be reflected in the body. And the adrenals will release stress hormone as a result. The issue that becomes why people end up coming to see docs like me is that the stressor isn't cleared. It just is allowed and we might not even be aware of it, but it could be just some chronic stress that we're dealing with, and it's just in the background and we're not necessarily paying attention to it. It could be financial stress. And that cortisol state can start to, early on, will just become really elevated. We'll kind of get into this a little bit more deeply, but also your DHEA, your epinephrine, your norepinephrine, usually early on, all of your stress hormones will be high. And the issue is when that stress is not cleared and addressed, that ultimately is what leads to dysfunction. All right, so I put some signs and symptoms of adrenal dysfunction here. I italicized and bolded the ones that are most commonly seen by me. So weight gain, especially in the midsection, fatigue, sleep disturbance, which can either be difficulty falling asleep early on. Later, it usually tends to be difficult staying asleep. You can start to have a burst of energy. That's usually also an earlier symptom with adrenal dysfunction, where you're in a wired and tired state. And so even though you want to go to sleep, there's just too much stress hormone flooding your system in the evening time, which makes it difficult for the system to shut down and go to sleep. So that's tired at night but can't go to sleep. And then I mentioned the waking, and then the morning fatigue is another classic pattern that we'll walk through in a minute. Exaggerated menopausal and andropausal symptoms. This is really important, and I'll touch on this a little bit later, because the more we get the adrenals under control, it's going to help us later to be able to balance your sex hormones better. Brain fog is a classic one. Carb and salt cravings, another big one. And then this is really one I see in most of my clients who have any HPA axis dysfunction. It's a slump in afternoon energy. And classically, I see this anywhere from 2 to 4 in the afternoon. And that's usually when folks are starting to reach for either some sort of carbohydrate or caffeine, something to pick them up. And so that's a really important symptom to be aware of. I see these generally all very commonly, but those are the ones that I see most commonly. Okay, so when we start thinking about the stages of adrenal dysfunction, this is something where your functional medicine provider is going to be thinking. So the first stage is early adrenal dysfunction or HPA axis dysfunction. This happens with a perceived stressor, and that's when you're initially in the fight or flight state early on. What happens with this response early on is all of your stress hormones are often elevated. So that's going to be your epinephrine. You're also going to have elevated cortisol, DHA, and insulin also can early on be elevated as well in response to an acute stressor. Next, the thing to understand at this stage is that you're actually able to appropriately respond to stress and flood your system with these different stress hormones to respond. So you tend to be more alert and you're able to even be able to respond better. And so this early on does not present as too much of a problem. However, if we see anything, this is usually when people are starting to have difficulty sleeping, and then they may have some fatigue as well associated with this stage. Next, the second stage is when you're in more of a wired and tired state. So this is kind of a little bit more advanced. The stressor has persisted a little bit longer. And so what we see with this is elevated cortisol, epinephrine, insulin levels in this stage as well. We also start to see at this point that your DHEA is now starting to decline oftentimes. So cortisol will still be elevated and still responding, but we can start to see the DHA starting to decrease. Now, the issue is when we're catching you, we don't know sometimes from the numbers, the labs that we do with folks, we don't know if we're catching you on the way up or the way down. So a lot of your functional medicine providers are going to use history along with labs to be able to understand what is going on. So your adrenals are still able to respond to stress, but the DHA is now falling, the other hormones are still up, and although you still feel alert, you tend to start to feel more wired and tired. That's the person who can't fall asleep at night, and they just can't shut their mind off. That's something that we often see in this phase. And then we also see resulting fatigue. And so these are the people that are reaching for caffeine or stimulants. They'll oftentimes end up being prescribed stimulants at this stage as well. Patients also can start to become hypoglycemic. So their blood sugar is not regulated as well because insulin and glucose get affected by adrenal dysfunction. They can also be at this stage start to become more tired after meals. So they don't have that support from the pancreas and the endocrine system that's involved and affected by adrenal dysfunction. At this stage, it's also when people can start to become more anxious and irritable with all these stress hormones circulating. So then when we get to the third stage, that's generally exhaustion. And at this stage is when all of the hormones are pretty low now. So you've got a low cortisol, a low epinephrine, low DHEA. Your sex hormones at this point also can be suppressed if you're still making sex hormones. So this is when the client is coming in and they're just really tired, and they can be tired all the time. What we start to see at this stage is sexual health issues as well. So low libido, ability to reproduce or get pregnant, depressed immune system, because your immune system is also suppressed with chronic stress that's involved too. So I mentioned blood sugar can be thrown into a dysregulated state, but so can your immune system. So you can start to see more upper respiratory infections, more allergies. You can also see pain is increasing at this stage. Workout recovery is not as great, or maybe even more injuries. You can have less stamina. And one thing I can see in my later stage adrenal dysfunction folks, they're more tired after exercise. Exercise wipes them out. So it's not like you get a good workout and whew, it's not that. It's like I have to lie down for several hours and take a nap. So exercise is depleting. We also start to see more brain fog, more sleep disturbance, and this oftentimes is not just difficulty falling asleep. This actually can be difficulty staying asleep, and they can be waking often at times. And again, the mind can be racing at this point, as well as when we spoke about it in the last stage. We start to see a different type of depression at this stage. So that's something that a lot of your functional medicine docs will be looking at. You can't detoxify as well, because remember I said what happens over here is your primary responsibility of your system at this point is just to deal with stress. And it does not understand that psychological stress, so whether it's mild physical or not even mild, but a physical ailment or disorder that's going on, or emotional stress that you're having, or mental stress, it does not understand that that is not truly a tiger chasing you all the time. And so it's going to stay in that state. And that allows you not to do as well what you're meant to over here in rest and restore, which is detoxify, digest, balance and produce sex hormones, deal with blood sugar, support your immune system, and on and on and on. So the more that we persist over here in this dysregulated state, it starts to impact your system throughout. The one other thing I'll say at this stage, because a lot of times I'm dealing with folks with thyroid imbalance, especially hypothyroidism, when we are in a persistent state of stress or severe state of stress, it's really throwing the body into HPA axis dysfunction. The thyroid hormone cannot convert as well. So you can't convert T4, your mostly inactive thyroid hormone, to T3, which is your most active thyroid hormone. So you can start to see clients with more and more stress. So this becomes really important to really be aware of and stay in a state of coherence so that you don't find yourself in this position. And if you are, there is a way to switch out of it. And then lastly, at this stage, we also start to see people turning even more to caffeine, and they almost require it, and they're requiring more throughout the day. This is, as I said, people start getting prescribed stimulants, and that could be medication for just anxiety. Sometimes it's also for depression, and that actually can be masking the issue rather than getting at the true root cause. So the last stage that I'm going to talk about is severe adrenal dysfunction. That is very rare for me to see, but I have seen it. And this is when your body stops being willing to produce any significant amount of stress hormones. And this is after prolonged severe stress or severe acute stressor. It's very rare to progress to this stage, but if it does, this requires more intervention, sometimes even medication, to shift a patient out of this stage. So you really want to catch it as early as possible. Like sometimes I'm seeing my 20-year-olds and I can see them, they're on their way up early in the stage of HPA axis dysfunction. Like I'll see a high DHA on blood lab tests, and maybe if I get a Dutch test, I might actually see their cortisol curve and see how it's dysregulated. And I'll go through that in a minute. But the earlier that we can catch this really becomes very important to our whole system and health in general. All right, so when does adrenal dysfunction occur in someone's life? It can happen at any age, but I really start to see it really having impact with significant signs and symptoms in people's 30s. But as I mentioned, I see more and more 20-year-olds where I'm seeing more of the anxiety, more of that wired and tired state. So I'm starting to see it earlier on, but most of the time I'm catching it in people's 30s. So with that said, if we can pay attention to the signals that are going on in our body and start correcting them, that can be very helpful as we start to get into perimenopause, menopause, and andropause. And perimenopause can be starting in people's late to mid 30s at this point. And part of that, I personally believe, it's because of the chronic stress, whether it's just toxic load or just stress that we have in general, that it's moving that up earlier and earlier. But this becomes important because your adrenals are really meant to support you as you get further into your experience of your hormone life. And if you've kind of maxed your ability to address stress out, your body's not going to deal with supporting you with hormone production. And this becomes really important for women especially, because most of the residual sex hormones after a woman enters menopause are supposed to come from the adrenals. So like I said, if your body's still over here dealing with stress, it's not going to help you out with hormones over here. So very important to be thinking about. So the adrenals, we've got our classic tiger or lion that is, supporting you to be in a fight or flight. in response to the stressor. And this is a very primal response, and it's important. Now, when we start to think about the adrenals with sex hormones, this is very important because in premenopause and pre-andropause men and women, very early on, so we're talking people's 20s, teens, the adrenals may not even show up as a problem hormonally. But as I said, we do see this more and more as people advance in their life. So what else do your adrenals influence? They influence sleep, your stamina, your fluid balance, your blood pressure, salt and mineral balance, blood sugar regulation, as I mentioned, your immune system and inflammatory response, storage of fats, carbs, and belly, and that can result in belly fat if the adrenals are in a state of dysfunction. They also influence carbohydrate metabolism, your ability to detoxify, your muscle, joint, and bone health. I've already mentioned blood sugar and insulin regulation, thyroid function I mentioned, sex hormones I mentioned, vitality. So a lot of my clients in 40s, 50s, 60s, 70s, they are really interested in that. The more you preserve your HPA axis health, that will be helpful. And then also wound and injury healing. So again, your body's in a state of stress. All these reparative things are not a priority. All right, so the parts of your adrenals. We have something called the adrenal cortex, which makes your sex hormones, DHA, pregnenolone, estrogens, testosterone, and progesterone. They also make cortisol and aldosterone, which I'll speak to in a minute. And then we have the adrenal medulla, and that makes your epinephrine and norepinephrine. So those are some of your stress neurotransmitters. So let's start first with aldosterone. We're not going to talk too much about this, but since you have an understanding how this impacts blood sugar, the balancing of minerals and electrolytes, aldosterone is what is doing that in the adrenals. So it's a hormone that can inhibit sodium excretion in the urine and promote potassium excretion in the urine. And this helps to maintain the volume of blood in our bodies as well as our blood pressure. And we start to see this in some folks who have high blood pressure and swelling in their limbs, usually their legs. And that sometimes we'll see this accompanied with HPA axis dysfunction that we're classically speaking about with stress. The second hormone we'll speak about is cortisol. So this influences everything that we just said. I don't think I need to restate that, but it does play a huge response in the stress response, or a huge role in the stress response. Our adrenals also have the ability to make sex hormones. We're not going to get into that. And then I mentioned earlier epinephrine and norepinephrine, which are commonly in lay people's terms known as adrenaline and noradrenaline. So these hormones influence your blood pressure and heart rate. They sharpen your brain, increase pain tolerance, and increase blood supply to the muscles. This can also trigger carbohydrate release from your system for fuel. And this is all to prepare your body for a stressor. So think, tigers chasing you. You want higher blood pressure, higher fast rate so you can mobilize your system and get away from the physical threat. Sharpen your brain so you can think better and faster to avoid the threat. You don't want to be able to experience a lot of pain because you need to be able to get away. And you want more blood supply to the muscles to help you to be powered to move away from the stressor. You want more carbohydrates to be released into the system so you have fuel to do all of this. So you can see this is a very elegant and beautiful system that's been designed not to hurt us, but really to support us to be well. Okay, so adrenals and balance. So as I kind of mentioned, everything is meant to be in a state of balance to support you with stress temporarily and then to move on. There needs to be some sort of balance in the system. So how would you know if you're just at home? How could you understand if you're likely to have healthy adrenals and HPA axis or not? So some things you can do is you can first check your blood pressure first when you're lying down, and then sit up and recheck your blood pressure in 3 minutes. If you see that top number, which we call your systolic number, drop more than 20 millimeters of mercury, then that's a sign of adrenal dysfunction. If that bottom number, which we call your diastolic blood pressure, drops more than 10 millimeters of mercury, that's also a sign of adrenal dysfunction. So that's a quick one because a lot of folks have access to a blood pressure monitor. So that's one you can do. There's also one called Dr. Arayo's iris contraction test. And this maybe a little bit more challenging, but you sit in a dark room in front of a mirror with a flashlight. You shine the light into an eye from the side of your face. And if your pupil doesn't dilate, or sorry, doesn't contract for 2 minutes, then that's a sign of adrenal dysfunction. And remember, I said one of the things, or I don't know if I said this, but one of the things that happens when we are in a fight or flight state is our pupils dilate, and that's so that we can see better in order to get away from the true threat. So if you actually can't contract your pupils in response to light, that's a sign. Next thing that you can just do is look in the mirror and look if you have a lot of fat that's accumulating in your midsection. That possibly is a sign of adrenal dysfunction as well. Because remember I said when that insulin and blood sugar metabolism gets dysregulated, carbohydrate and fat deposition and metabolism get dysregulated, we tend to store it in the midsection, which is called visceral fat, and it's really meant to protect us. But over time, that's very pro-inflammatory and actually is more of a problem supporting disease and disorder. But that's probably the simplest way to get an idea. So what would your functional medicine provider do to assess for adrenal dysfunction? One of the simplest things that I personally start to do is order a serum DHA sulfate or DHAS. I like my clients to have a level of 150 to 200. That's where I have found over the years that people are in a more optimal state. Now, I have to say I'm using a lot of signs and symptoms to help guide me with that, because as I said, just a number is not going to tell me if you're earlier in your experience with stress and have a high cortisol, or whether you're kind of in a more dysfunctional state where you don't have the capacity to make the hormones, or your adrenals are not making the hormones the way they used to. Some doctors will check a serum cortisol level as well. I personally am not a huge fan of this, but just so that you're aware of that is something that some doctors will look at. And I should say providers. When we're really, really curious and we can't get an idea of whether someone has or the type of adrenal or stage of adrenal dysfunction a person has, then we might get a saliva adrenal stress index or a Dutch test, which I'll talk about in a minute. I have found, though, the more and more I listen to history and then get a DHA sulfate by blood, I oftentimes am going to order this test if I feel like it's going to be helpful to the client to see how the stress is showing up in their body. So I put 3 examples here. This is actually from a Dutch saliva test. And so what this is called a diurnal curve. And what's supposed to be happening is that when we wake up in the morning, our cortisol should be elevated. And then it should ideally, so don't follow this blue one, follow what I'm saying. Ideally, what should be happening is it stays in between the upper and lower black line and it's high. And then it stays somewhat high, but drops down a little bit, but staying between those 2 lines throughout the day. And then slowly drops, but stays in between those lines into the evening. That's ideal. So what that means is that you have plenty of cortisol available for you early in the morning to help you wake up, stay awake. And then as the day goes on, you need a little bit less. And so it slowly declines. And then it's lowest in the evening. But it stays between those 2 black lines because that's what's needed to support optimal energy and other things throughout the day. So then what we see in this first pattern is it's appropriately elevated in the morning, but it starts to drop pretty early on, 30 minutes after waking, or even before that, you start to see it drop. And then it's almost below the line until the late afternoon, early evening, and then it goes high. And what we don't catch is the cortisol that's happening in the middle of the night. And usually when I see a high cortisol in the evening, which is the last collected saliva sample that someone's doing, that usually means that they are either going to have a difficult time staying asleep, but maybe also falling asleep. So that's something to be aware of. So that's one pattern that we can see. This goes along with a little bit of a mixed picture, but a wired and tired pattern, and then kind of a low pattern of cortisol throughout the day. The second one is showing that the person starts into high of a cortisol state. So the cortisol is really high in the morning, above what it needs to be. So they're already starting up in a very hyper cortisol state. And then it drops, and you see it drops pretty low by midday. It's really low. So this is a person who's probably going to tell you they're more tired in the afternoon and evening, and they're almost struggling to stay awake. It's probably someone turning to caffeine, sugar, maybe even needs some sort of stimulant from their doctor, or some anxiety medication from their doctor, and maybe even a certain type of depression. This third pattern is the person starting off way too low. So they're starting off with a very low cortisol. So this person is going to have a really tough time getting out of bed. They're going to have severe morning fatigue. Then you can see they get a nice pop a little bit later, and it actually stays pretty high through the day, but then in the evening it's pretty low. So this may be someone who starts to also have mostly just difficulty getting up in the morning. But what I was going to say is sometimes what I'll see is that when it's that low, the cortisol might be increasing and popping up in the middle of the night, making sleep more difficult. So sometimes you're going to have to, or a provider is going to have to deduce that through history. So this is called a saliva ASI, or adrenal stress index, and you can get it with what's called a CAR, a cortisol awakening response, or not. What I kind of explained what the curve is. The curve just in general is letting us know, how are you responding to stress? Are you in a chronic state of stress that's kind of flattening your line, so you have no energy? It's in a high cortisol state, so it's flooding your body with stress hormone. It's also letting us know, how easy is it going to be for you to have energy to do what you need to do, and how is it going to be influencing sleep, possibly anxiety, etc. A CAR is going to let us know, do you have an appropriate response in cortisol release that's going to help you in the morning? And there's a range that we look at that's appropriate to see if it's too low, so you don't have the necessary cortisol response to support getting up in the morning. That is one thing we'll see, and sometimes we'll see it's a little bit too high, so it supports a hypercortisol state. So these are kind of tools that your doctor may use to help you to really understand what's going on in your system. All right, next, very similarly, you can do a dried urine test for your adrenals, and you can get it with hormone metabolites. In the curves will look very similar, or depending on what's going on with the specific patient, but you'll produce diurnal curves that we just looked at, and it'll tell us the pattern and help us to understand exactly what's going on. So it's similar to saliva testing, but a little bit different, and your provider may order that for you. Okay, so one of the things I mentioned early on is that one of the things that we can do to help support adrenal wellness, and therefore whole body wellness, is to allow our heart to guide the adrenals. So remember, we started by shifting into a state of coherence. The more that we're willing to allow our heart, the master gland in our system, which is our direct link to whatever we call our higher power, that the heart energy, whether you kind of liken it to a higher power or not, that energy, the more we're centered in it, is actually going to help to guide the entire system and all of the activity in the body. And so you'll throw your body into a state of coherence, which then all of the systems work together. So your gut is working at the direction of the heart with your nervous system, which is working with your muscles. So you don't have all this activity where every organ or gland is doing its own thing whenever it wants to in a very dysregulated state. The more you're in that heart-centered space, the more you're going to support all these systems working together to support wellness. And so the key is to get out of a state of stress, being guided by your heart, so that the whole system gets over here into rest and restore, repair, detox, etc. Okay, so how do we do this? Well, I'm just going to give a few tips. So one way of doing it is to focus on developing and creating more yin energy in your life. So adrenals are associated with the kidney energy in the Chinese medicine model, and this is yin energy. This is cultivated through stillness, through rest, through meditation. The other thing that you can think about when you're looking to balance your adrenals and wondering, how did I get to this space? Look at, are you consistently holding thoughts around fear? Because that generally is the underlying root of, in modern day society, of what's driving stress. And it's usually at the emotional or mental level, but it still could be at a physical level if we're creating some sort of imbalance in the body. But it's very important to look at, do I have a lot of thoughts of fear? And the more that we can start to recognize that and start to follow our heart more and more, that can be one of the things, we're removing one of the root causes that can be supporting this imbalance of your HPA axis. Sometimes this will show up as a lack of self-care, a lack of self-worth. Sometimes we're using a lot of willpower to achieve our goals. So we want to make X amount of money and get promoted and whatever, just to fulfill certain worldly goals. It can be not being centered in whatever your higher power, however you connect to, something larger than yourself. All of that can be supporting an imbalance. And the more that you're willing to consider shifting into a different mode, that will be helpful. So an action step that you could do is ask yourself, how much time every day are you cultivating this yin energy through meditation, mindfulness, walking in nature? And are you at least spending 30 to 60 minutes in stillness and meditation? You could just be watching nature, having a cup of tea. That will throw you into more of a coherent state. You could be playing with your child. That could throw you into a coherent state. Playing with an animal. All of this could be really helpful in supporting you being in coherence. Another step that you could use is to look at, do I feel defeated in life? So sometimes when we're very driven and ambitious, that can be something that when we're not hitting that mark or that goal, we start to feel unworthy. We start to feel like we don't want to care for ourselves. We start to feel disconnected from others and any higher power that you may have in mind. And then pay attention to if you're anxious, because I've noticed some people are anxious and it's not obvious. So they're not walking in like worried about everything, but it's just there in the background. And just start to look at how much you may be thinking about how you're trying to control things at a lower level rather than allowing yourself to be guided to support whatever it is that you need. And then one of the things we talk about with nutrition, and this is something you may need help with, but the more you can remove things that are overstimulating or detoxifying to your system, that can be helpful. So you may consider, when you're ready, taking a 7-day challenge and eliminating all sugar, eliminating all processed food, all alcohol. All of these things are obstacles to the adrenals and your whole system, frankly, being in a state of wellness. And then think about eliminating caffeine, but that needs to be done slowly in a very planned out manner, because if you just stop cold turkey, you could not feel well. You could have headaches, etc. So I put down here how you can start to think about doing that. You might start to incorporate a little bit more plant-based food to help to support you through all the phytonutrients that are available in the foods. And I especially encourage people to eat a couple servings of cruciferous vegetables, so like broccoli, kale, cauliflower, to help support detoxification via the liver. And then at least 5 to 6 servings of vegetables during the day, because each color of vegetable or fruit, but I would stick more with the vegetables to reduce the sugar load, except things like berries and things like that. Each color has a phytonutrient that is associated with a different supporting nutrient to support your system. And then another thing that you consider doing is supplements. I personally think that you should do these with someone who really knows how to manage them. And of course, you should not be pregnant or nursing. But some of these things, these hormones, I'm kind of going to go over them very high level, but some of them you don't want to use at certain stages of adrenal dysfunction. So that's why I really recommend you work with someone who knows how to use these. So the first supplement that I mentioned are adaptogens. So common ones that we use for the adrenals are Panax ginseng, ashwagandha, ginger, holy basil, rhodiola, passion flower, and Siberian ginseng. These all support throwing your body into balance. And depending on the stage of adrenal dysfunction is very important, because certain ones are used in certain stages. But they are herbs that will respond to stress depending on where you are. So some of them are more geared toward increasing your cortisol when it's low. Some are more geared to pulling your cortisol down. So Panax ginseng, this is one you want to be careful if you have high blood pressure. Because it can exacerbate that. Licorice, also be careful if you have high blood pressure. But licorice is one that increases cortisol and supports a restorative adrenal response. Rhodiola is one that is really helpful and can be used throughout different stages of adrenal dysfunction or HPA axis dysfunction, but overall it's improving your response to stress. Astragalus is another important adaptogen. It supports your immune system and stress response. Vitamin C is not an adaptogen or herb, but it is a cofactor that's needed for your adrenals to optimize hormone production in the adrenals. Magnesium is probably one of my favorite supplements, if not my favorite, because it is involved in over 600 reactions in the body. It helps to bring or regulate your stress response. It's very calming, supports your adrenals, your heart, and it's a natural relaxant in the body. And then pantenoic acid or vitamin B5 is another cofactor needed to support your adrenals. B complex and B12 are additional cofactors. So a lot of times you'll see in adrenal supplements all these cofactors that I'm speaking of, where your doctor may add them or provider one by one. Tyrosine is very helpful from a brain chemistry perspective and how it's affected by stress. It can be used on stressful days. Zinc and selenium, very supportive antioxidants. These are ones that you don't want to use in excess because you can get too much of either of those. Chromium supports blood sugar regulation. And then sometimes we'll use what are called glandulars for your adrenals that can be derived from cow or porcine pig gland. And they really should be used with physicians. They're a little bit stronger and you want to know where you're getting them from.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.